How can we maximize the number of people receiving COVID-19 vaccine as soon as possible? This is a question many people are thinking about right now as we continue to fight the COVID-19 pandemic. Hello everyone, I'm Naveen Agarwal and I want to welcome you all once again to my weekly video update. As we know, 2 vaccines for COVID-19 have been authorized by the FDA for emergency use. The first one came from Pfizer-BioNTech. The second one came from Moderna. And I've talked about both of these vaccines in my other videos you can find on my YouTube channel. But in this video, I want to talk about the vaccination program and some of the new ideas that are coming out to maximize the vaccination program and speed it up significantly. As of January the 8th, 2021, according to the CDC, only about 6.7 million vaccines have been administered. So that's the number of people who have received the first dose. But 22 million have been distributed. So yes, the first question, very legitimate question to ask is, why aren't we able to get shots in the arm? We still have vaccines in the field, doses in the field. Why aren't we get them into people as soon as possible? And I know people are working on that. The second question is, we are holding back 50% of the supply in inventory to give as a second dose to these people. As we know, these vaccines require 2 doses. For Pfizer-BioNTech, the second dose comes 3 weeks after the first dose. And for Moderna, the second dose comes 4 weeks after the first dose. So the current policy is to hold 50% of the inventory to give to these people as a second dose. Now, the downside is we are not able to vaccinate more people. So one proposal I have read in the news recently from the Biden administration, the incoming administration, is to release everything right now and maximize the number of first dose vaccinations. There's a downside to that, and they have received very heavy criticism from people. The downside really is that what happens if there is a massive disruption in supply and we don't have anything left anymore to give as a second dose? We are delayed for a very significant period of time. Is it really a risk worth taking? Not only are we going to be out of compliance, that's not supported by clinical data and FDA's authorization, but could we be actually doing more harm to people who have received the first dose versus not giving any vaccine at all? So people are beginning to think about that. Well, I came across a very interesting paper published in a journal called Annals of Internal Medicine. This is published by researchers from the Stanford University. And in this paper, they are presenting a model, a simulation, a model about vaccination program. The first scenario is a fixed strategy, which is hold 50% in inventory. And they have a certain supply rate, a stable supply rate, and they say hold 50% in inventory. In the second scenario, they are looking at what they call a flexible strategy. One case could be over an 8-week cycle, you hold only 10% in the first 3 weeks, 90% in the next 3 weeks, and 50% after. So it's just a variation, not saying that's optimal, but it's just a variation. And the question they are trying to answer is, do we get any incremental benefit? Now, just to clarify, they are not saying we will delay or not give the second dose. Everyone who receives the first dose will get the second dose according to the dose regimen in the emergency use authorization. But can we do better? Can we incrementally vaccinate more people? The results are remarkable. They're able to show that you can incrementally vaccinate 2.5 additional people and reduce the number of COVID cases by about 30%, even when there is a moderate disruption in supply. And that's fantastic news, because with the same amount of stuff, we can vaccinate more people and not have as much risk. We could do that. So this is a out-of-the-box thinking and could work, right? So that's very good news, because as we know that if we reduce the number of COVID cases, we reduce the number of hospitalizations and we reduce the number of deaths. So the benefit is significant. Let's take a situation where a disaster happens and the supply is completely disrupted and for some reason we are not able to give the second dose in time. Now, we are going to be out of compliance for sure, but could it be a very big risk? Could it be a disaster situation? So I thought about that and looked at some data that was presented to the FDA in the authorization request package, both from Pfizer and Moderna, in order to think about that. Just really consider what might happen and what might be an extreme situation. So I looked at the data on the levels of neutralizing antibodies as a function of time after receiving the vaccine. And in case of Moderna, this looks really quite promising. Neutralizing antibodies, we know, is how the vaccines are going to protect us. These are all mRNA vaccines, and they stimulate our system to generate these neutralizing antibodies. So we are prepared. When the virus comes, we are prepared with these neutralizing antibodies, and the virus cannot be operating well or cannot enter our cells anymore. That's how they protect. So levels of neutralizing antibodies is a proxy for level of protection. Okay, so in case of Moderna, after the first dose, there was an increase of about 7 times in the level of neutralizing antibodies compared to the baseline of no vaccine, only after first dose. And after the second dose, the level of neutralizing antibodies increased close to 60 times, right? It's a big jump. So let's say that we don't give the second dose or we are delayed. We will have a fair amount of neutralizing antibodies in the system. And that's just a median. Of course, there will be some people who have lower amount, some people who have a higher amount. But as a median, we will have neutralizing antibodies in the system. Now, this is a hypothesis, not proven out by data. What happens if a person who has only received the first dose and have neutralizing antibodies, they get infected? Are they able to tolerate the infection much better than they would otherwise when they had no neutralizing antibodies? Or it doesn't work as much? It depends. Maybe in a very high risk population, the first dose is not entirely effective or efficacious. We are assuming about 50% in general, but there might be a group which will have maybe less than 50% efficacy, and the level of protection after just one dose may be much lower. They might be more vulnerable. But the question remains, it is possible that even after the first dose, and the data has shown efficacy, data has shown that you will have some level of protection. So it is not an absolute disaster for sure, right? We will have some adequate level of protection. Certainly not ideal. And some groups may still be at very high risk, but it is not a disaster situation. And if that happens, then we are somewhat protected. I look at this as an analogy of a shield. We are in war and we are completely exposed and unprotected, which is what the situation was when we had no vaccines. Now, the question we are asking is, do we move more people behind a shield which is not perfect? It is not providing perfect protection. It has some holes in it. Or do we wait and move only some people behind a perfect shield? That's a question people are asking to make a public health policy. And the new administration is trying to take a new approach. It is not a disastrous situation, even if there's a disruption in supply, right? That's an assumption we are trying to figure out. Okay, so having said that, now let's consider the scenario that, again, as I talked about, we have a delay. We have some disruption in supply. We will still have some protection. So why don't we consider this idea? Let's give the first dose to as many people as possible, like we are thinking, but prioritize the second dose to high-risk people. Prioritize it, right? In case we run out. Shoot for 100% coverage, but give priority to the second dose to the high-risk people. Now, it becomes a little bit complicated to manage, but if you could do that, it's possible. So it is an opportunity for us to think outside the box. Look at a risk-based approach, do benefit risk assessments, and then figure out what is the best way to execute to protect as many people as possible. I hope this was very helpful and useful to you to think about it in a different way. I'm sure you are hearing about this in the news media all the time. But I wanted to dig a little bit deeper, as I always do in my videos, and present to you something more to think about. So I would like to hear from you. What are your thoughts? Do you have other ideas that could be implemented to improve our rates of vaccination? We are anticipating that by June, July, 200 million doses would have been administered. But could we do it faster? I think that's a question. So I would love to hear from you. Drop a comment or engage with me on LinkedIn. Follow me on LinkedIn. Let's have a discussion over there because I'll really love to hear from you. I want to thank you for your interest and attention, and I look forward to hearing from you.